presentation outlines the critical principles of vertical HIV transmission, also known as mother-to-child transmission. Understanding the mechanisms, risks, and mitigation strategies is fundamental to the clinical and public health objective of eliminating pediatric HIV infection globally. We will explore how to protect the next generation effectively through proven medical frameworks.
Our primary learning objectives are to identify the 3 primary pathways of vertical transmission, quantify the associated risks involved in each stage, and describe the evidence-based interventions that have dramatically reduced transmission rates. These strategies are the foundation of modern obstetric and pediatric care for families living with HIV. The transmission of HIV from a mother to her child can occur at 3 distinct stages, beginning during pregnancy. This first pathway involves the transplacental transfer of the virus from the maternal bloodstream through the placenta to the developing fetus. Monitoring maternal health during this period is vital for early prevention. The second stage of potential transmission is intrapartum, which occurs during the process of childbirth. During labor and delivery, the infant is directly exposed to maternal blood and genital secretions. This stage represents a high-risk window where the virus can enter the infant's system through mucosal contact during birth. The third pathway is postpartum, occurring after birth via the ingestion of breast milk. Breast milk can contain the virus, posing a continued risk to the infant during the breastfeeding period. Understanding these 3 distinct windows allows clinicians to target interventions specifically to each stage of the child's development. Without any medical intervention or preventative measures, the cumulative risk of transmission across these 3 stages is significant. It is estimated that between 35 and 45% of infants born to mothers with HIV will acquire the virus. This high percentage underscores the urgent need for comprehensive clinical management. The cornerstone of prevention is the administration of antiretroviral therapy, or ART, to the pregnant individual. Comprehensive treatment during pregnancy, labor, and the postpartum period is designed to suppress the maternal viral load to undetectable levels. This is the most effective method available for preventing vertical transmission in modern medicine. Further risk reduction is achieved through tailored delivery management based on the mother's viral load. A specific threshold of 1,000 copies per milliliter is used to determine the safest delivery method. When the viral load is above this level or remains unknown, specific surgical interventions are recommended to protect the infant. A scheduled cesarean delivery is the preferred method for individuals whose HIV viral load is greater than 1,000 copies per milliliter near the time of delivery. This procedure is strategically timed to minimize the infant's exposure to maternal blood and genital fluids, significantly lowering the risk of infection during birth. Post-delivery, the focus shifts to the newborn. Prophylactic treatment of the infant with antiretroviral medications provides an additional, critical layer of protection. This infant prophylaxis is a standard component of care, acting as a safety net to neutralize any potential exposure that may have occurred during the birth process. Global guidelines on breastfeeding are context-dependent and vary by region. In high-resource countries where safe and reliable alternatives to breast milk are readily available, individuals with HIV are advised not to breastfeed. This recommendation aims to completely eliminate the approximately 14% risk of transmission through breast milk ingestion. In resource-limited settings, the World Health Organization recommends continued breastfeeding for at least 12 months, coupled with sustained ART for the mother. This approach balances the risk of HIV against the protective benefits of breastfeeding in environments where clean water and infant formula may not be consistently accessible or safe. The WHO recommendation is based on evidence that the benefits of breastfeeding in preventing infant mortality from malnutrition and other infectious diseases outweigh the risk of HIV transmission when the mother's viral load is suppressed. In these contexts, breastfeeding is a life-saving intervention for the child's overall health and survival. The significant decrease in pediatric HIV incidence in many countries is a direct result of these multifaceted prevention strategies. By combining routine testing with medical interventions, we have seen a transformation in outcomes. This success story demonstrates the power of evidence-based public health initiatives and consistent clinical diligence. The key takeaway is that vertical HIV transmission is a preventable condition. A comprehensive approach combining routine testing, effective maternal antiretroviral therapy, strategic delivery methods, and infant prophylaxis forms the foundation of modern clinical practice. Together, these interventions have proven to be a major and lasting achievement in global health.